Welcome to today's video on the 7 warning signs of stroke. Recognizing these can save a life. In this video, we'll explore everything you need to know about stroke, including the different types and the 7 key symptoms. Stroke is a leading cause of death and disability in the United States. Each year, around 795,000 people in the United States have strokes. It's important to remember that stroke can affect people of all ages and backgrounds. Strokes are medical emergencies, and the quicker the response, the better the chances of minimizing damage and improving recovery outcomes. I know you've heard the word a stroke before, but what exactly is a stroke? Stroke is a serious medical condition that happens when blood flow to part of the brain is disrupted. This can be caused by either a blockage in an artery or bleeding in the brain. Because the brain cells aren't getting the oxygen and nutrients they need, they start to die, and this can lead to lasting damage and even death. Alright, let's dive into the 2 main types of strokes. There are 2 main types: ischemic and hemorrhagic. An ischemic stroke occurs when a vessel supplying blood to the brain is obstructed. The main cause of ischemic stroke is atherosclerosis, or fatty deposits that line the vessel walls. While hemorrhagic stroke is due to bleeding into the brain by the rupture of a blood vessel. Now, let's explore 7 early warning signs of stroke. Number 7, vision problems. If you or someone you know experiences sudden blurriness in one or both eyes, it could be a sign of reduced blood flow to the brain. This blurriness might come on quickly and can make it difficult to see clearly, even with corrective lenses. Also, double vision. If you start seeing 2 images of a single object, can be disorienting and dangerous, particularly if you're driving or performing other activities requiring clear vision. Double vision can occur when the nerves controlling the eye muscles are affected by a transient ischemic attack. Vision loss, sudden, temporary, or permanent loss of vision in one or both eyes, is a serious symptom. It can occur without any preceding trauma or explanation. This loss might be partial, affecting only parts of the visual field, or complete, resulting in total blindness in the affected eyes. Recognizing vision problems as potential warning signs of a stroke is crucial for early intervention. Number 6, sudden weakness or numbness. One of the most common and recognizable early warning signs of a stroke is sudden weakness or numbness. This symptom typically affects the face, arm, or leg, and usually occurs on one side of the body. How can you tell if someone has sudden weakness or numbness in the face, arm, or leg? For facial weakness, if you ask a person to smile. If one side of the face droops or appears uneven, this is a strong indicator of a stroke. The drooping may also be noticeable when the person tries to speak or eat. For the arm weakness, if you ask a person to raise both arms. If one arm drifts downward or cannot be lifted, this is a sign of arm weakness. The person might also feel a sudden heaviness or inability to hold objects with the affected arm. And finally, for leg weakness, similar to the arm, one leg may become weak or numb, causing difficulty in walking or maintaining balance. Number 5, sudden severe headache. A sudden, severe headache with no known cause can be a warning sign of a stroke. This type of headache is often described as the worst headache of one's life and can come on abruptly. The headache typically starts suddenly and may reach peak intensity within seconds to minutes. It may be accompanied by other symptoms such as nausea, vomiting, or altered consciousness. The pain is usually more intense and different from any usual headaches the person might have had before. A severe headache associated with a stroke is often due to bleeding in or around the brain, known as a hemorrhagic stroke. This type of stroke occurs when a weakened blood vessel ruptures and bleeds into the surrounding brain tissue. The sudden increase in pressure within the skull causes the severe headache. Number 4, speech difficulties. If you notice a sudden problems with speaking or understanding speech, these are common symptoms of a stroke. These difficulties can include slurred speech, inability to find the right words, or complete inability to speak. Speech difficulties arise when the stroke affects the areas of the brain responsible for language, such as Broca's area and Wernicke's area. These regions are involved in producing and understanding speech, respectively. Number 3, unexplained fatigue. One such sign that often goes unnoticed is unexplained fatigue. Unexplained fatigue is a sudden, overwhelming sense of tiredness that is not directly attributable to physical exertion, lack of sleep, or other common causes. It is more intense than regular tiredness and can impair daily functioning. This type of fatigue can come on abruptly, leaving the person feeling drained and unable to perform usual activities. Number 2, unexplained dizziness or loss of balance. One symptom that can be particularly insidious is sudden, unexplained dizziness or loss of balance. Dizziness refers to a range of sensations, such as feeling faint, woozy, weak, or unsteady. Balance issues, on the other hand, involve difficulty maintaining equilibrium, resulting in stumbling or an inability to walk straight. Together, these symptoms can significantly impact a person's ability to perform daily activities safely. Common dizziness can result from various benign causes such as dehydration, inner ear problems, or a sudden drop in blood pressure. However, dizziness related to a stroke is typically more severe, sudden, and accompanied by other neurological symptoms. It can also manifest as vertigo, a specific type of dizziness where there is a sensation of spinning. Number 1, confusion or cognitive changes. Sudden confusion or cognitive changes can be alarming indicators of a stroke. These changes may manifest as difficulty understanding information, confusion, or trouble performing cognitive tasks that were previously manageable. For instance, an individual might suddenly struggle to follow conversations, experience unexpected memory lapses, or find it challenging to solve problems or make decisions. These symptoms arise because a stroke disrupts blood flow to parts of the brain responsible for thinking, memory, and comprehension. When these areas are deprived of oxygen and nutrients, their functionality is compromised, leading to abrupt cognitive impairment. The person might seem disoriented, unable to recognize familiar surroundings or people, or may have trouble articulating thoughts clearly. Recognizing these cognitive changes is crucial, as they often occur alongside other stroke symptoms like sudden weakness, numbness, or difficulty speaking. However, cognitive changes alone should not be ignored. Even in the absence of more obvious physical symptoms, confusion and cognitive difficulties warrant immediate medical attention. Strokes are medical emergencies that require immediate attention. Early detection of symptoms can lead to faster medical intervention, better management of risk factors, and improved overall outcomes for patients. Public awareness and education, coupled with proactive healthcare practices, are essential in addressing the risks associated with these symptoms and enhancing stroke prevention and response efforts. By understanding and acknowledging these important warning signs, we can take crucial steps toward reducing the impact of strokes and saving lives. If any of these symptoms occur, it's important to seek medical attention immediately, even if they seem to resolve quickly. Early intervention can significantly improve outcomes and reduce the risk of a full-blown stroke.